Put your arm straight out.
Okay.
Cool. I'm going to push down. You resist.
Okay.
So I'm testing his front deltoid, and it's strong when I push, okay? But I'm also using it as a guide to be like, hey, body, how you doing? Cool. Do you like to be seated? Yep. Stand up.
Okay.
Hold strong. Do you like to stand? Nope. So as hard as he holds, he won't be able to hold up.
Yeah.
What we're talking about with Ali, like he's been training a lot, and tell me a little bit about the foot, right?
So basically, I tweaked it, and it feels like I have a bruise on the bottom side. And after I start running for a little bit, it feels like I can't put any pressure on it.
And when did you really notice the foot?
Last 2 weeks ago.
And that's
Yeah.
and then how many miles were you running then?
12 miles that day.
Okay.
But I didn't run all the way.
And it's kind of random. So what we're doing, we got Ali here. He's been doing a lot of training, especially over the quarantine. He's been putting a lot of new weights, training his body, and like put a lot of muscle on, getting stronger. It's really awesome. He's been doing a lot of cardio. Then the only variable that I want to discuss with him are his shoes and everything, all right? So do me a favor, lay here and stick your feet out this side.
Yeah.
Okay.
Yeah.
When someone has pain, when someone's been running a lot, and they particularly have pain on the outside of their foot here, this is the most common area for a stress fracture in a foot, okay? So that's why, if you're just walking around and you have pain here, it would be unlikely to have a stress fracture. But if you've been running and the amount of training that he's doing, and you have pain, particularly on this fifth metatarsal here, I always send him for an X-ray to rule that out, because it's the type of pain that you won't have any pain walking around. Once you start running, you'll have pain here. So we got an X-ray. It was negative there, which was great. Okay, so I don't send everybody for an X-ray of their foot unless there's done something pounding or repetitive thing. And you can get a stress fracture. You can get a stress fracture just by repetitive use. It doesn't even have to be a lot of force. It has to be a lot of jogging. But you just get a little stress fracture that you can barely see, but it'll hurt. And then you just really have to take off running. So we ruled that out on him. Then another thing that I want to show you guys is, can you take off your glasses and go face down?
Yep.
Please. Comfy?
Yep.
Right on. So when I look at my man here, now what we're doing here is if you come straight down and look at his feet, right? And push straight down, you can see there's a little bit of a leg length difference, particularly on the right, okay? If you come here, it's kind of hard to see, but you push straight down, right leg is a little bit short. This is the leg with the problem, correct?
Yeah.
Okay, turn over on your back. Now, we're talking about anatomical leg length, okay? With chiropractic, some people can have a leg length difference, right? And sometimes if your hips have gone anterior or posterior, it can pull your leg up or it can push it down. And so then you can adjust the hips, it can put everything back in alignment. The difference between an anatomical leg length difference that you're born with and you've had all your life versus a chiropractic is this, okay? So here's Ali. Right, left, Ali with his, you got some curly hair. Okay. So this is way exaggerated, of course, okay? Right leg is short, left leg is long. This is like, and when I say short leg, it's like millimeters, okay? And it's not like some people you get on the table and they're like that, and that's pretty significant, okay? But I'm just gonna put a shoe lift in here, but his body is used to this much of a leg length difference, and so we wouldn't do it. So, back to this, right short leg. Your hips are gonna be out of balance. Your spine's going to be like, okay, man, I'm going to go off the hips. Oh, gravity brings you back, okay? That's how somebody gets scoliosis, okay? Someone's not going to have scoliosis unless it was a traumatic injury without a short leg, okay? So there's no way this is going to happen. So that's what happens to have somebody scoliosis. Now, he doesn't have scoliosis, but right short leg, little curve in his spine. To confirm that, I have Ali stand up on by your side, and if I follow his spine down like this, I don't know if you guys can see that, but I can see that, okay?
Okay.
And you see this. To you, it might not look off. You see the right arm is a
It
little-
drops, right?
Yeah.
I've always noticed that in the gym. I'm like, that can't be right. But
And
I'm
the
like,
reason it
whatever.
does that is because it goes parallel with your spine. So then in the fact that this spine has, the spine here is curvy like that,
Mhm.
clavicles and everything's are here. So when I see this is occurring, and can I touch your back? You
Yeah.
can pull up your shirt?
Yeah, go for it.
Okay. And if you look at his spine, you can see a little curve, okay? You see how a little bit down here? Some people, when you do it, they'll be like, but Ali, a little goes to the left, comes back here. So that can confirm a true anatomical leg length difference, okay? I'm gonna get on the floor. This is how old people get on the floor with a bad knee. Oh yeah, that's how it happens. Okay. Oh, and then I kick my patient.
All good.
Okay. What I'm doing right now, okay? Sorry, the floor's cold.
I don't mind.
What I'm doing, there's a bone right here. It's called the navicular bone, okay? Can I make a mark on you?
Yeah.
This bone here, okay? This bone here, navicular, it attaches to tibialis anterior. So this muscle goes here, it goes here, and it attaches right here. This is the muscle, deviating of course, this is the muscle that you get shin splints in, okay? And this is the muscle that you're like, oh my god, I got shin splints, okay? Shin splints occur because this muscle attaches here, and if someone's not in shape enough, or they've been training hard, or their feet flatten, and they pull down, every time they step, pulls here. That's how you get shin splints, because of where the flattening of the arch, okay? So what I'm doing right now is I'm measuring where this bone falls when he's non-weight bearing, okay? I keep him like this. Don't look down. Sometimes if the patient looks down, I took my mask off because I got my test and I'm negative and I'm out of breath. So, I measure where his feet are when he's not standing. Now stand up and move your feet around and let him go wherever you want him to go.
Okay.
Okay, now I measure how far they fall when he stands up. Sit back down.
Oh, man.
So, if the theory is right, okay, that's your right side, okay? Right leg, when he stands up, his foot pronates, that's when it falls. When your arch collapses, called pronation. You know, probably like 6 millimeters. On the left, it flattens more. Now that also supports our theory with this, okay? I'm Ali. I walk like this. No, I'm just kidding. So, if you have a right short leg, your left is going to collapse more, okay? So you don't just lean. So this supports right short leg, okay? Left flattens more. Now his left foot hurts with the running, okay? Because this flattens. So if it flattens, when he pushes off, it's going to cause different gait pattern. You're going to think if this left foot flattens that he's going to have pain here, but it's more of when your gait pattern hits, you go heel strike, roll off, flatten. So now when he's heel striking, he has to really roll off. It's causing him his pain over here. So, excuse me, not bad. Okay, so just to clarify, these are insoles that you wear with your work shoes.
Yeah.
Never worn them in running, correct?
No.
Cool. Now, sorry.
All good.
Then Ali running, you made 12 miles in these shoes with no problem, correct?
Yeah.
Then he gets newer shoes, okay? Pretty similar, but a little less sturdy, okay? And they're very, very similar. Are they the same brand or just different?
I think
Brand.
yeah, they're the same brand.
Yeah. Were these specifically for hiking?
These were
Okay.
these were hiking.
And then these are
I
specific.
did a little bit of running in them, and then this was for trail running.
So they're similar model, but different something?
Yeah, different purpose.
Okay, so it doesn't really matter. I can't analyze why this is occurring. All I know is that these shoes, when he ran 12 miles in these shoes, it caused that, okay?
Yeah.
These shoes did not. So that's why we're trying to like see if perhaps a shoe insert would help. Now, want to see something else totally cool? Sit back down.
Yeah.
This is a little voodoo. It's called applied kinesiology, okay? And so, put your arm straight out.
Okay.
Cool. I'm gonna push down, you resist.
Okay.
So I'm testing his front deltoid and it's strong when I push, okay? But I'm also using it as a guide to be like, hey body, how you doing? Cool. Do you like to be seated? Yep. Stand up.
Okay.
Hold strong. Do you like to stand? Nope. So as hard as he holds, he won't be able to hold up.
Yeah.
I say, hey, now give yourself a little arch support. So go up a little
Okay.
and hold strong. So when I give him arch support, when I make him have his own feet come up,
Cool.
there's no way, watch, I can overpower him. Flatten out normal,
Oh.
hold as hard, there's no way he can hold.
Huh.
So,
I'm broken.
he's broken. You got to go. We're gonna be like, hey man, you like your shoe inserts? So step on these and put them where you think you would kind of be normal.
Okay.
Now muscle test again, okay? But just let your feet be normal. So when I test him with these shoe inserts, his body goes strong, okay? Now what I'd like you to do is step off of those, put these shoes on,
Okay.
okay? Awesome. Now stand in those and just be normal.
Okay.
So those shoes are not as supportive. Do you mind taking them off?
Yeah.
And then, so we're gonna test
Those ones?
these guys, okay?
Okay.
Now we're putting on his old shoes that he ran in, and we're seeing if the support is, oh, so interesting. So when I test him in those shoes, totally strong.
Okay.
And
So
watch,
change the shoes.
and then change the shoes. But now let's see, okay? So if you're putting shoe inserts in your shoes, you gotta take the insole out, okay? So some shoes, they're not removable, okay? So let's see what happens. Yeah, like these.
Those are these, right?
These are awesome,
Yeah.
but you
These are
can't
awesome.
really,
Yeah.
you'd have to peel them out, right?
I've put inserts in them before, but
You feel
you
okay?
can't take the inserts. They're not removable.
Now put these on with
Okay.
these insoles in, and we can see if he could run in these shoes, okay? Cool. Hold strong again. Yeah, so now we put insoles in his new shoes. They provide better support, and we test him. He's strong, okay? Take off those shoes.
Okay.
And I'm gonna lay here, we're gonna muscle test, okay?
Okay.
So some people think, oh, I'm just gonna put something in one shoe, but you're so used to that, you don't do that, right? If like, one thing if you had a huge leg length difference like this, but often just providing a little bit of arch support on both creates enough balance between that his feet won't collapse as much, okay? So leg length difference doesn't really ever matter unless it's causing a problem with an exercise or causing an issue, okay? What I'm gonna do now, we showed him last week, and Eric's been working on this, we're gonna muscle test the body, okay? Comfy in this position?
Yep.
Okay. I'm gonna put you in certain positions, I'm gonna test every muscle, okay? I'm gonna
Okay.
test the lower limbs because in addition to this leg length imbalance, we check to see if muscles are firing or not firing, okay? Bend here.
Okay.
Now I'm gonna put you in certain positions. You resist my movement, but don't go full force, okay?
Okay.
I'm gonna push, you go there.
Okay.
Ready, hold. Good. That's rectus femoris. I'm gonna turn you this way. I'm gonna push you here. You're gonna go
Okay.
there. Go. Lateral quad. Good. I'm gonna push here, you go there.
Okay.
Now the teardrop muscle, the VMO, when I isolate this guy, see how it's hard to hold?
Yeah.
Okay, straighten out. So what we do here, we start figuring out, that's left side, right?
Yeah.
We figure out what muscles are not working, okay? I say not working, people are like, it's always working. And they're saying like a muscle's turned on or turned off. It kind of means like every muscle has perfect length, too tight or too loose. When I isolate it, it won't hold strong. So this is cool because we'll keep going, okay? Now, I'm gonna turn you in. I'm gonna push you down.
So go that way.
Yep, but you
Okay.
gotta keep your head down because that makes things different. Lift your head. Put your head down. So if he lifts his head, it changes stuff. I'm gonna turn you here. Let me turn you in a little bit. I'm gonna push you this way. You
Okay.
go there. Ready, go. And that's TFL, okay?
Okay.
That's this muscle here, just like we talked about, okay? It keeps the hips stable. I'm gonna push out.
Mhm.
You go in. Ready, go in. adductor, super strong. I'm gonna push you in,
Okay.
you go out, and that out. Feel how the hip is off?
Yeah.
Okay. And that goes, it's really common way, and if we can get these guys going, TFL and abductors. Perfect. Now I'm gonna isolate the 4 major stabilizing muscles of the ankle, okay? We did this last time, we'll do it again. So hold your foot here, don't let me swoop you down. Okay. Sweet! Super strong. Hold your foot here, don't let me pull you down.
Okay.
Super strong. Point to me, point to the inside and hold. Now when I do that muscle, it doesn't hold strong. Point here, point out, I'm gonna push out. So we know 2 of the muscles that stabilize the ankle that are gonna help him be strong when he's running are these 2, okay? So Eric's already figured out that he's doing band exercises in a sitting position, particularly not here, but here to work these guys, okay? Now let's check the right side to see what your norm is, okay? I'm gonna push here, you go there. Awesome! Rectus femoris, I'm gonna push here, you go there. Good! Lateral quad. I'm gonna push here, and you go there. VMO is working on this side. Pull, heel to butt, please. Nice!
Okay.
Break my arm. I didn't do hand on this leg bend. Heel to butt, pull. Nice! Straighten out. Cool. Now this guy was off on the left, see the right. I'm gonna push this way, and you go there.
Okay.
Okay, and that one's, yeah, so his hips are gonna be a good thing to do some work on. People don't always know that the hips are stabilizers, okay? And if we can keep these guys stronger, it'll keep the knees from going in a lot when you're running, okay? Glutes aren't firing, right? And that means they're not firing in a correct pattern. Of course they're gonna fire, of course they're gonna work. But if you can't get this guy firing, sorry.
I'll do it.
The pressure can sometimes go to low back, okay? So with him, curl, heel to butt for me, please. Ready, go. Hamstring again, okay? I'm gonna lift you in the air.
Okay.
Now hold it up.
Alright.
I'm gonna keep your knee bent though. I'm gonna
Okay.
push down. So watch. That isolates glutes, okay? But his body is smart enough that he wanted to keep a little bend. So keep a little bend and do the test again.
Okay.
So when he bends, it recruits hammy and holds strong. When I take out hamstring and I push down, hold up.
Okay.
Can't hold. Relax, relax. Let's do this side too. Heel to butt, please. Nice! Up in there. Knee bent. Hold strong.
Okay.
Cool. And see when he bends a little, hold strong,
Okay.
he can make it strong. So relax, 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 relax. The glute max is not firing as properly, okay? So this is cool information because he's been training hard, he wants to keep going, and Eric knows a bunch of different rehab stuff that we do more to isolate the glutes, okay? And it's some stuff you can do at home, we can show you, but please turn over on your back.
Yep.
So our synopsis for our gentleman here. Been training hard. You like the running part?
Not particularly.
All right.
But yeah, I do. Love hate.
And so if we get everything balanced, he should be able to go back and run, you know, and so, but with that, we know he's got right short leg, okay? That's causing the left foot to, you know, pronate, which means the arch drops, okay? That's what's causing his pain, this part of the foot. We also now know, we confirmed this by seeing a little curve in the spine, confirmed that by measuring the arches, checked out what muscles are contributing to this problem, and then we also, this is right, this is left, lower leg. It's tib, ant, and post, and blah, blah, blah. It's muscles off. Then we know what to do here as far as like creating a specific exercise routine that's going to help him be stronger, that's going to help you with your lifts, that's going to help you do everything. If we can't get, we got to get glute max firing, so when you're doing your squat, it contracts, it doesn't go low back. So that's kind of a synopsis with Ali. Kind of gives us a plan, right? Like if Eric only stabilized the lower legs but didn't address the hips, as he adds in the mileage and your hips don't get tired, they're going to turn in more, and then it can create like a knee problem. So this is one of the analysis, one of our overall body exercises that we do together that we can kind of figure out. And then Eric works with me. We create a program specifically to fix these problems. And then, you kind of see him once or twice a week for a month, come back, retest, see what's going on. So,
You want to keep you don't want to have the foot completely straight out this way, because if you have the foot completely straight out this way, that's going to recruit other muscles.
Yeah.
Don't want to have it too far in, but kind of like a halfway point.
Okay.
Going to wrap the band around the top of the toe here.
Okay.
Now what we're going to do is we're going to go 10 seconds in. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Relax. Don't come all the way back out here. Keep it here.
Okay.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10. We're going to do that 3 to 5 times.
Okay.
And the next one we're going to do same position. This time we're going to go out.
Okay.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10.
Got it.
Go.
Yeah.
try it.
All right. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Back out. Back in. 2, 3, 4, 5, 6, 7, 8, 9, 10. Now we're going to do the opposite direction. Yep. Also, I'm glad you did that. So one of the things you want to do is if he's going out that way, you want the band on the inside. If he's coming in this way, you want the band on the outside. All right, so again, and go up. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Back in. Out. 2, 3, 4, 5, 6, 7, 8, 9, 10.
What I like about Eric is the fact that he knows that, like, the muscles when the toe was up were strong. So he had him in the place to where it really mimicked the muscle testing. So he's already strong here. So I like he had his foot lower, and you guys have been working together. So that's awesome. Then he sends him home with the homework as well. This guy, okay? And it connects to IT band, and it kind of goes with glute med. So these muscles of the hip on both sides were not strong when I was testing him, okay? So Eric's going to show him just like a rehab thing that's everybody should be doing for our hips to really isolate these. It's different than inners. People are like, oh, I'll do inners and outers, but it's just, this is different. So, and the movement is you isolate here. So all of the weight is on the left. You're gonna do both sides even because you're off. And then the foot, you have to turn your toe in quite a bit.
This one?
Yes. Now his toe turns in and comes out, okay? And you come out as high as you can, keep the toe turned in.
That's as high as I'm
Yep, face the wall, head up. So when you do these exercises, you have to be upright. If you look down at your foot, you're training your body and mind to be smarter looking down. So you're like, hey, I'm smart when I'm running. I've trained myself like this. You look up, you might do something off. So, so stand up, perfect. Perfect. Foot out. 1, 2, 3, 4, 5, come back down. Out. 1, 2, 3, 4, 5, come back down. It's interesting because he is funny with like the tightness in his hips and glutes. Want to step aside. So like, I don't have any tightness because I've been working out. So, so it's funny because Eric's so tight he does this, and so for Ali, toe comes in here, and it's like I feel it immediately here. You want to make sure this butt cheek doesn't do that.
Okay.
You're gonna turn this toe inside.
Okay.
Yep. Keep the head up straight, toe inside. You're gonna bring it up. 1, turn it in. 2. There you go. See, he's got the same thing. Yep.
Okay.
Go, I'm gonna hold the hips here. Now go ahead. Turn the toe in. 2, 3, 4, 5. Back down.
Toe in the whole time.
Toe in. So yeah, there you go. Now go 2, 3, 4, 5. Back here. A little bit slower.
Okay.
So when you come up, I want to turn it in here.
Oh, okay.
And then when you come up, you just come up slow. There you go.
Okay.
Now go. 1. There you go. Right there. 2, 3, 4, 5. Back down. And up again. 1, 2, 3, 4, 5. Back. Yep. Square the hips out. Now turn. There you go. 1, 2, 3, 4, 5. Back down. Turn in. 1, 2, 3, 4, 5. Back down. This hip is obviously looser than that hip.
Yeah.
You can turn this one and do it fine. And then when you're doing these, you don't necessarily have to swing it all the way up.
Yeah.
You just go as high as you can go. So if you can only go this high, that's fine.
Okay.
If you can go this high, that's fine. But the goal is just to go, because if you can keep it here and only can go here, that's fine.
Okay.
Eventually, you're
Get
gonna work
the
it all
full
the way.
range.
Yep.
Okay.
Down, back up. 1, 2, 3, 4, 5. One more time. 1, 2, 3, 4, 5. Well, that was much better. Cool. How's that feel?
Hard.
Yeah, it's hard. It's hard. Because you're literally trying to turn this in, keep the hip straight, and you got to squeeze your glutes. Yep. So go to the other side. 1, 2, 3, 4, 5. Back down. And 1, 2, 3, 4, 5. Down. How'd that feel?
Good.
You feel that?
Yeah.
Okay, cool.
Feel it in my butt.
All right, what's going on, guys? Eric Brown here. Just want to stop in real quick, let you guys know I'm a physical therapist assistant here at Dr. Trumpi's office. I've been doing this for a couple of years now, certified and educated. Also, if you guys have any questions outside of here, I do personal training, ebfitfitness.com, fitness for everybody and anybody, whether you're at home, whether you're on the road, or if you want to travel in person. as well as my services are mobile. Certified in master training, women holistic hormonal health. I also have proficient in experience in helping people with rehab and injuries and things of that nature. Again, if you guys have any questions, you can reach out to me here at Dr. Trumpi's office, or for outside inquiries, ebfitfitness.com. Thanks again, it's Eric Brown. What we're gonna do here, so what the E-stim is gonna help us do is gonna help us relieve some tension and obviously help us with inflammation in this leg here. I'm gonna do about 10 or 12 minutes. And what you typically want to do is you kind of want to find the pain point or the pressure point. So, how's here?
A little higher.
Here? Or back this way?
I think there's more right here.
Right here?
Yeah.
Okay. So you put one there. Try not to have them too close. Always try to have them about that far apart because you don't want the complete muscle spazzing out. And then we go, typically either go below where the pain is, or you go to the opposite side. Because obviously we don't have that much space here on his foot, we'll go here on the opposite side with the E-stim. All right, go ahead and bring your legs up.
Oh,
Cool. How's that feel in the back?
feels
Pretty
great.
good?
Yeah.
All right, so I'm gonna plug these up for you. So I'm gonna cut this one. Do this one, these two first, all right?
Okay.
Let me know when you feel it,
All right.
and then let me know when to stop.